Good morning. It is about 3:45 in the morning and I am about to start my day where I always start it, in my basement, to do a little bit of a workout.
Back to the legs, glutes, quads, release tension in your feet.
This is the thing that actually makes my morning run, which is coffee. And it is almost 5 o'clock. We are about to leave. Okay, it is 5:15 and I'm walking into the hospital right now. As an intern, I'm just kind of about 5 blocks away. Just walked, but now we have a house, so I have about a 15-minute drive into the hospital. And I'm gonna walk in, get changed, and start our morning. Okay, street clothes are off, scrubs are on, and we're gonna go to the ICU and start rounding. I'm just gonna run in and grab a pager. Most important part of trauma surgery. And we're ready to go. So 6:30, first trauma of the morning. We went down to do an assessment, got a bunch of scans. The good news is that it looks like there's nothing kind of intra-abdominal or in the chest that we would need to deal with. Patient is going to have some extremity fractures, but we have a great orthopedics team that will be managing those sorts of things. So nothing on our end, but I'm sure the rest of the day has lots of busy things for us.
Hey. Hello. Good. How are you guys? Oh, do you have this like a basket? We're gonna look at the scans, but I think it's
So one of the ways that we start our morning pretty much every morning on the trauma service is we do a big meeting with our whole team to run through all of the patients that have come in the last 24 hours, talking about kind of what injuries those people had, what surgeries they had done, what surgeries they still need done, and what care those people need, so that everybody on the team is on the same page, kind of moving into the next day. And one of the things we talked about was all of the surgeries that we're going to do for the day. And one of those things we're about to run down and do is going to be a video-assisted thoracoscopic surgery. So we'll be seeing that in a couple of minutes. But before we did that, we took our attending, Dr. Snyder, around the unit and talked about all of the surgical patients who are in the ICU still needing care, coordinating that care for the day. We spend a lot of time talking to the ICU team and other consulting teams to make sure that everybody has the information they need to move those patients' care forward during the day, plan additional operations they're going to do. In addition, talk to families that are at the bedside about kind of things that are going on with their loved ones and updating them on plans of care.
this morning, so they made an NPO.
Oh, so that can't go so much way.
Well, you know what, new.
So the next thing we're going to do is go ahead and move into the operating room. This morning we'll be doing a VATS, which is a video-assisted thoracoscopic surgery. Basically, sometimes people who have been in traumatic injuries end up with blood that's in the chest that can't be evacuated with a chest tube. So we have to do that and remove that surgically. One of the things that's really incredible about this program is the kind of minimally invasive exposure that we have and all of the training that we do in everything from really simple minimal invasive procedures to even the most kind of complex like these.
That was my name. I was like, what? I anticipate, yeah.
So we finished up in the operating room. We managed to complete our VATS. Everything went really well and came back up to the unit where we had to do a tracheostomy. One of the things that we do as surgical residents is lots of bedside procedures, so things like chest tubes and trachs. And we have really excellent support from our ICU teams in order to be able to do those things safely in the controlled setting of the unit. So now with that knocked out, we're going to go back down to the operating room to do another case. In the elevator going back down to the ER because the level 1 pager just went off. I think this is our 4th level 1 today, so it's busy. So we did our second big case of the day, which was another VATS. And that patient is going back to the floor right now. And it looks like I just got a call from our resident down in the ER that they just found someone with appendicitis who's going to need an appendectomy. So we'll be headed down to do that here in just a couple more minutes and keep rolling on through the night.
Okay, so I have what I started as kind of a tradition as the call chief, that anytime I can, I try to get the consult resident, who's my junior resident, on with me at night, coffee. So we always have call team coffees. So Will, who's my PGY3 on with me tonight, I'm gonna go bring him his coffee downstairs.
Okay, we are getting a little bit of a break. Our case is on hold. The OR staff is available to do it. So I am taking the opportunity. I am going to eat my dinner and give a call to my kids at home so I can say goodnight before they go to bed.
Mwah! I love you. What are you doing?
I think you can't be up here before we do this. What?
I said, what are you doing? What are you doing?
One appendix out. Time to check on the ER and see what the night has left for us.
But he is a Bosnian-speaking gentleman.
Thank you so much for taking the time to spend your day with me. I hope you got to see a lot of really exciting things. We have an incredible program here at Washington University in St. Louis, and I couldn't have been happier to spend the last 7 years here.